and I am the lead coordinator on all of our community health assessment work. Today's meeting is going to be an overview of the next steps in our community health improvement process and where we're headed within this work. And first, I'd just like to start off by saying thank you so much to everyone for taking their time out of your day to be part of this and for joining us here. It's very excited for us to see so many people from the community that are interested in learning more about our process and in being connected to this work as we move forward. Our kickoff meeting today is going to be facilitated by Corinna from Conduent Healthy Communities Institute. The health department has been working with Conduent for a little over a year now. They've been providing us with technical assistance and support throughout all of our community health assessment work, and we are so thrilled to have them with us today. And so with that, I'm going to go ahead and hand it over to Corinna.
Hello, good afternoon, everyone, and thank you for joining. We have a huge turnout today, and we are very excited to have you all here with us as we go through the community health improvement process that we've been working on with Washtenaw County. Please feel free. We are going to be recording the session. We do also have closed captioning for accessibility, and I also sent out the slides via email just about around 2:40 to anybody who had registered to attend the session, so please feel free to follow along on there. You can also keep yourself mute. You can come on camera or go off camera. It's completely up to you. We are just very excited to have you here with us. Again, my name is Corinna Kelly, and I'm with Conduent Healthy Communities Institute. And we have been on an incredible journey with, like I said, Washtenaw County on this community health assessment and really supporting the health department as well as the community and the partners. So this next phase that we are getting ready to begin, and we are very excited about, is this one that takes most of the work, and it really takes all of us to be actively involved and engaged so that we can make an improved impact in the community. And so really what the goal is of the community health improvement plan and what we're beginning into now is to help establish a joint strategy among Washtenaw County Health Department as well as our community partners. We really want to engage and really have active participation in leading or overseeing some activities and actions throughout to improve health outcomes for Washtenaw County residents. So this is your community health plan. Take ownership and stay tuned. We have some upcoming opportunities to really get involved, and we'll talk about that later on in this meeting. So a few of the objectives that we'll be going through today, and we will have a few opportunities for some questions in between. I have a colleague of mine who's on the call, and I'll introduce her in a minute, who will be helping to facilitate answer any questions that may be coming through chat. But today we're going to be going through a few introductions very briefly, just letting you know who we are, what part of the process we are involved in. We'll be reviewing the community health assessment process and priorities, so telling you a little bit about how we got here to this point. And then we'll be talking a little bit about the CHIP process moving forward. So that's our strategy plan and how we're going to be building that from this time over the next few months. And then we'll talk about some next steps that'll be involved and answer any questions that you may have to help you better understand this process, as I may know that this process may be new to some of you. So for those of you that can and are willing and would like to, please, introduce yourself via chat. Teams is new for all of us, and I do appreciate your ability to log in and to download Teams. Up at the top, you'll see a bar of different icons. One of them, it looks like a little box, and it says chat. If you click on that button, you could type in your name, you can type in your title or your organization that you work with, just so we know who's all in the room with us today. So please feel free to take a minute to do that now. Awesome. So I'm seeing some come through: Community Mental Health Partnerships of Southeast Outreach, Trinity Health, I see some acronyms in here. I'll have to ask you about those later. WISD, I'm thinking it's Washtenaw County Independent School District. Just taking a guess. WCCMH, Ypsilanti District Library. I've learned to love the way that that sounds, Ypsilanti, so I like to say that. Center for Health and Research Transformation. Thank you. County Health Department. We got deputy health officers here. Wonderful. So please feel free to continue to introduce yourself. It's definitely a great way for anybody who's on the call to know who's in the room, which will be very important for some of the questions that I have for you guys later. So we have, like I said, a big group that have registered and some people who may not be able to attend with us. Thank you. So a little bit about our project team. As Dana mentioned, we've been working alongside her. She is the community health analyst for the Washtenaw County Health Department. We've been working, myself, Eileen Aguilar, and myself, Karina, as public health consultants and project managers for the team. And so I've really been, pivotal in just helping them and guiding them through this process. So again, Eileen will be assisting in the meeting chat and any questions that you may have that I may not be able to get to right away, she'll be letting me know. So for today, it's very important that we get connected with this work so that we can prepare for the next phase on really building this strategy plan. And in order for us to do that, we do need your assistance here as we have some guiding questions for you just to really think about as I go through the data assessment outcomes and just really helping us to think outside the box. So some of the questions to think about as I'm going through the rest of the slides and some of the data information is what organizations and sectors must be engaged for us to have a successful process. Also start thinking about, are there any historically unrepresented groups who should be at the table and who should we be inviting to the table to really help assist us as we build the strategy plan that's owned by the community. So again, we have a couple examples of some organizations. We have some of those that are here today with us of the county. So please just, start thinking about who we can really engage in these next steps. So I'll start us off in the community health assessment and process and the CHIP priorities. So this is showing us how we got to this moment. So this image here is showing how Washtenaw County Health Department community health improvement process looks like. So this process is really a continuous cycle. We don't really ever stop. We just continuously go through this every 3 to 5 years. Every health department is going through a community health improvement. So the first phase is, and really the purpose of this is to improve community outcomes by engaging our community partners and organizations so that we can address health as well as social needs of the communities that we serve. And so Washtenaw County Health Department is currently involved in that community health assessment phase, moving to the implementation, as you see CHIP written in there. So we're moving into the community health improvement planning phase, and then we'll go into the action phase of actually implementing the actions and the strategies that we put together, some of those goals that we put together within the next couple of months. And really what this process is, I wanted to show you just a little background of the process and why we're using this, this process and this framework. So to effectively and efficiently really guide our efforts in the community health improvement planning process, Washtenaw County is utilizing a framework called MAP. And MAP, what it stands for is Mobilizing for Action Through Planning and Partnerships. Nothing that you have to remember, but just, something that it shows where we're getting our information from and what's guiding us. And so MAP is really a national framework that is used by health departments across the country. And Washtenaw County chose the MAP process, the framework to utilize to guide our efforts because the MAP framework focuses on community engagement, which is a huge part of why we're all here today, and also improving health equity. So MAP recommends that we complete certain assessments and processes. And if you're interested in learning any more information about MAP, we can definitely give you the link. So just please input that in the chat, and we can send you some of that information to learn a little bit more about some of the details. So let's take a brief look at the data analysis overview. I know this may seem a little overwhelming, but this part was what we completed during the community health assessment phase. And so the community health assessment phase is a collection of various data methods that guide us and to understand what the community is really going through, what their lived experiences are. And it really helps us identify what those significant needs are of our community. So first part of that data collection piece that we conducted for Washtenaw County was HCI actually conducted a secondary data analysis. And when we look at secondary data, what that means is that we're looking at various local data in the local Washtenaw County. We're looking at Michigan state data. We're looking at national data comparisons, and we're trying to see the trends. Where are we trending in this data? Then Washtenaw County Health Department, what supports our secondary data is the primary data, which is collected specifically from key partners and stakeholders that live within Washtenaw County, as well as some residents that live within Washtenaw County. So we collected, Washtenaw County collected various interviews as well as focus groups with those key community members who share their lived experiences with health issues in the county. And another data collection method that Washtenaw County Health Department utilized was conducting windshield tours or assessments. And what these are is they go around to different neighborhoods and townships and to the city and actually take a look in a bigger picture of what is going on in the community. And one of the last things that we conducted was a community health survey. So sending out a survey virtually, we also did some paper surveys and got information and feedback from Washtenaw County residents on the health and the social needs of their community. And after all of that data was collected, we came up with 9 overlapping health and social needs. And so overlapping means we took the data, pulled out some of those key themes from all of those data points. And with that, we looked at what was overlapping. Those overlapping showed us what was the most important, the most significant to the community, because it means it was said multiple times in various different data components. So these 9 overlapping health and social needs emerged. From this point, Washtenaw County Health Department considered multiple different community stakeholders' input, and they held series of prioritization sessions. And what these were, some of you may have been at the State of Our Health in Washtenaw County Community College event. That was one of the in-person events where they shared the data with the community, allowed them to discuss and to provide feedback, and it gave them an opportunity to vote on these health topics to identify the top 3 that we can move into the next 2 to 3 years for our community health improvement plan. There was also, again, other in-person and some virtual sessions that were considered where other community stakeholders had an opportunity to prioritize and to vote on these health topics. And what we came up with, the top 3 health topics that were identified were mental health, healthcare access and navigation, as well as access to healthy foods. And so with this, these are the top 3 prioritized health needs that will take us into the next phase of the community health improvement plan. So we will establish goals and priorities around these health needs. Now, we will utilize a lot of the data points that we had collected around these health topics to guide us and to really streamline the process. And I'll explain that in some of the next steps that I go through. So I'm taking a moment and looking through chat. Eileen, do we have anything? Just want to see, have any questions?
No questions yet.
So, well, I have a question for all of you. And please feel free to input those in the chat, and we can take those out at the end of this presentation. And I'll also be able to address some of those today. So which organizations or programs are actively addressing those 3 priority areas? So the priority areas again, and I'll show this to you, are mental health, healthcare access and navigation, and access to healthy foods. So what organizations or sectors are addressing any one of these health areas? And this will help us, getting some of this information from you guys will help us in identifying who needs to be at the table with us as we make plans. And so I'm seeing various different organizations coming up. Like I said, food gatherers. I'm seeing the Food Bank, Ypsilanti District Library, Trinity Health Ann Arbor, Washtenaw ISD. I'm seeing WCCMH, CMHPSM, WHP, The Corner for ages 12 to 25, Health, Growing Hope. Wow, I'm getting some great ones. Planned Parenthood, Packard Health. Wonderful. Thank you. Please keep those coming in. Again, this will go through and see who we have already invited and whose input we need to facilitate and get going forward. So going into the next phase, so thinking about the community health improvement plan and the process that we have already are taking to move forward, is one area is looking at, this is really the pathway to transforming health. And again, the community health improvement plan is helping us do that. So we are actively engaging with the community. Washtenaw County Health Department has really made community engagement a priority throughout this entire process. So there are going to be other opportunities throughout this next couple of months to hear your feedback, to get your input, and also to get the community's input, because that's really what's going to help us transform health, is that collaboration and planning together. And then also moving through and taking action together as well. As I had mentioned before, that it does take all of us to be actively involved and engaged to really make an impact and outcome and establish what that looks like. So we'll also be communicating and engaging, like I said, throughout this entire process so that we can see what improvements we are making and where we may need to make some changes. So really what we utilize to do this and how HCI is helping to support these efforts is creating a roadmap. It's a roadmap of how we will get to our destination. And I love this image because, number one, I love taking trips. So a map always tells me we're going somewhere and we're moving into a direction. And so with this, we start off with our starting location of where we're at and where we're trying to get to. So creating a measurable change and improvement. We establish landmarks so that we can see what those milestones are and we can measure our success over time, or also see if we need to make changes to where we're going. The directions that we're going to be putting into this plan are specific activities, resources, responsibilities of individuals and organizations, money that may need to be allocated, or funding or advocacy work that may need to be done, will really help direct us and get us to the destination that we all want to get to. So our timeline for the community health improvement plan, it really starts now. We've been engaging since January in going through what our prioritized health needs were going to be, and finalizing some of those prioritization sessions. So we reviewed the community health assessment and prioritized needs. I'll actually share a link with you later, and it'll show you where you can access some of those community health assessments, some of that data that I had shared with you earlier, as well as some images and stuff from the State of Our Health event. So we've been planning and working through this from January. We've communicated the results. Washtenaw County has already done a couple of news events and as well as articles and publishing this information to the public and giving them opportunity to provide feedback. This next phase that we're going through from April to June is a kickoff, which is starting us off in the direction for you guys to understand how we got here and where we're moving. We're also going to be facilitating some calls and some workshops to help go through, what's going to guide our work, who needs to be involved, establishing some goals. And strategies and an actual plan to help us move forward. So that will go through June. We're going to also finish up in June to gather some more community feedback once the goals and the are already established, as well as what that plan will look like. And then in July, we're hoping to finalize that plan and to also share that plan with the community, as well as organizations that are here today, and put this on their website. So we do have a website that's available. It's the eChaw, so it's an electronic version of a community health assessment, and we'll also create an eChip, which is also an electronic version of the community health improvement plan. And we also will have these plans in a document that can also be printed out as well. So what are our next steps, and how can we really build on this collective impact? So I'd like to show one of the things that we collected back in last year when we had started this process. We did a community partner assessment, and some of you may be familiar with that. Some of you may have attended and participated in this survey that we put out for community partners to provide feedback on why they want to be a part of this work. Why is it important for us to work together? And I like to mention this because this is what keeps us together, is building that consensus and working together on a common interest, right? So a couple of things that were said during that survey was the reason why we wanted to work together with the Washtenaw County Health Department and the community was to create long-term and permanent change. Another one was to deliver programs effectively and efficiently and avoid some duplicated efforts, to increase communication, and also to build networks and friendships. So remembering why we're doing this work will really help us as we move forward with this work together and keep us together to centralize, like I said, on that that priority that it means much to us as far as improving the outcomes for Washtenaw County residents. So I'd like to know a little bit from you guys. I got a lot of feedback from the first question and hoping to get some more from the second question. And so my second question for you is, what can we do to ensure long-term impact of the community health implementation plan? And what we mean by we is we as a community in Washtenaw County, community health, the health department, the partners, what can be done so that we can keep and create a long-term impact. And so we want to hear from you, because this will help us as we go ahead and move forward into our planning phase and getting some ideas to best keep us connected. So I'm getting some information, ensuring that there is a plan for funding stability, which is very important. I'm getting a couple people second that. A coordinated system of care for mental health needs. Getting some people who are living that as well. So using a collective impact model with a backbone organization to facilitate regular communications and data review, as well as coordinated activities. Amazing. So yes, lots of collaboration efforts. Recognizing interconnectedness of health issues and needs. Also, ensure that there is a focus on root causes. Definitely will be something we talk about moving forward, is what are some of those root causes, and we do have a few of them that were included from the community survey from actual residents that filled that out. Providing ongoing training and certification for community health workers, absolutely, who are the backbone of a lot of our work. Adding veterans to the survey that's sent out to capture this population. Great. Great. Getting a lot of people who are seconding and liking the ideas that are coming out. A suggestion to open house event today to really learn the insight of who is behind the door of our partnerships. Very important. I know this may change over time and we may get new partners, absolutely. So Marines are working on the eastern side of Washtenaw, making health programs more accessible to people on the west side of Washtenaw County. Keeping in mind organizations that are more connectors to service, but not actually providing the needed services. That's wonderful. Great. So these are really great things for us to keep in mind as we move forward. I have one more question for you guys before we move to the next phase and the next one. So please go ahead and keep adding ways that we can build that long-term impact. But my next question for you is, what do you hope to see from this process? And being specific, are there specific outcomes or ideas for ways that, would include your involvement or ways to get involved?
This is Renee. I apologize. I'm not familiar with Teams at all,
absolutely.
So I don't have any access to the chat. I'm not really sure why. If anyone has any shortcut key commands for getting to it, that would be helpful. I'm way more used to Zoom. But one thing to answer the most recent question you asked, which kind of relates to the other questions, but one thing I would like to see is a more trauma-informed approach to a lot of the needs in our community and the inequities. So those top three things: the mental health access, the healthcare navigation, and the food. Especially the top two. I think the food has more to do with infrastructure, but the top two, I think, really emphasizing the training and a trauma-informed approach um, to empowering and caring for people in our community who experience these inequities.
Thank you for sharing that, Renee, and I apologize that you didn't have access to chat. And please feel free if there's anybody else who's new and can't, access the chat feature, please feel free to come off mute. Thank you for reminding me that some individuals may be having some issues with that. So I am seeing a few things in chat that, hope for improvement for this work is SMARTY goals, which are smart, measurable, attainable, I think right, and then the timely and efficiently goals, and inclusion. So center equity in our work. And then YDL just went through trauma-informed, okay, so some information on informed training, much needed with our library branches in Ypsilanti. Thank you for being very specific. I did see somebody come off of mute. I don't know if you want an opportunity to speak. If you weren't able to include it in chat, please feel free. So as you all continue with some of those, ideas on your hopes for this process, again, this is not the only opportunity you will have to provide your feedback, and those will be welcomed as we move into other processes, other phases of this process. I'll share the last one somebody had mentioned, said 5 conditions for collective impact, which is some shared agenda, shared measurement systems, mutually reinforcing activities, continuous communication, backbone support, and the collective impact. Yes, great. So thank you, Erin. We do utilize the collective impact model as well as various frameworks as we build on that, on our implementation planning. So I'm going to move us forward to the next steps and really what this means. And so partnering for success in ways that we're going to, proceed forward. One thing that you guys can do in the meantime before we start, some of these workshops is reviewing the Washtenaw County Health Department executive summary, as well as some of the data findings from the community health assessment. Again, we call it eChaw because it's available electronically, but the executive summary is also available to print, which would be more of an overview of what was conducted for this assessment, where the data points came from, who, it's not who, but more so what were the key themes that were said during some of the data collection pieces. So looking over them, seeing if you have any inputs as we move forward with those 3 health priorities. Another thing is the community health, the CHIP, the community input questionnaire will be going out at the end of this week, either tomorrow or Friday, and it will also include a link to this recording. It will also include the questionnaires as we plan for those workshops. So we'll be going through the questionnaires prior to the workshops to gather some input from you all, whether you're as part of those workshops or if you're just assisting. We'll be going through some of that input that you provide that'll help guide us in planning. And then also, please feel free to sign up for the Washtenaw County Health Department email updates. I've included a link, and I'll also try to put this in chat so you have, Eileen, I don't know if you can get that link and put that in chat. That may be helpful for people to click on. But definitely sign up for the Washtenaw County Health Department email updates. You'll learn about what's happening next, where there may be opportunities to participate or opportunities to learn more about these processes. And so the priority area workshops, again, will be happening within the next 2 months. They will be over mental health. We'll be looking at some of those key themes that we pulled from the community health assessment, as well as some ideas and suggestions from community partners. We'll be incorporating feedback from those individuals that need to be at the table for mental health, healthcare access and navigation, and access to healthy food. And Eileen has already put the link in there to participate and sign up for the health department email. And so I know we were finishing a little early, so I'm going to get you out of here a little bit earlier, but I wanted to see if you had any questions, and also wanted to thank you for participating and learning a little bit more about this process, how you can be involved, what our next steps are, and how we're going to help to move in making collective impact. And I see some hands raised. So there is a feature at the button you can raise, and it looks like a hand just says raised. So I see someone is using that option now. I will allow you to speak, sir. Let's see. It's Chuck. Here we go.
Can you hear me? Yeah.
I can hear you.
Can you hear me pretty good?
Yep.
Okay, I came in a little bit late. I apologize for that. But I heard you speaking about the Washtenaw Health Department. And as the CV member, I'm required every month to go to the health department and give a report for the equity committee that we're in. And I've been doing it for like 2 years now. And I encourage everybody to on Fridays when they can at 9:30, at least sit in on them. If you Zoom or in person, or if you can't, they provide recordings of it. You can always go back and get the recordings of it. It's a lot of things that you spoke on that the health department answers every month, because I get a chance to watch them in action, prepare stuff, present things, draft stuff, and a lot of times being in their meetings, you get a chance to have a lot of input as well as firsthand knowledge on what's going on in the community. And I don't see a lot of people doing that. I'm always almost only one in there most of the time, and I encourage anybody in this group that. It's free, just at 9 o'clock, 9:30 on Fridays. Just, if you can't get there, you can Zoom. You can ask questions in the beginning. So if you got anything that you want to ask the health department, when they first open up, they give you a minute to come in and introduce yourself and ask a question. So you also can do that. So that's, I mean, so I encourage and I repeat what you said. This, I think everybody should be involved in that, especially in this group right here. So thank you.
This is Renee. Are you talking about the Board of Health meetings? I'm confused about which meeting you're talking about.
Yes,
Okay.
yes, the Board of Health meetings. Yes.
Okay.
Yes.
Okay.
Great. Thank you for that information, Chuck. If you have any information or if anybody does about those Board of Health meetings and how individuals can access it, please feel free to put that in the chat so we can share that with anyone.
I will. I'll send a link.
Thank you.
I did just put the link to the Board of Health page in the chat. So that has the information, the meeting schedule, as well as the Zoom link. Thank you, Charles, for bringing that up.
Great, thank you. And I did see also, Susan, so there was a question about baseline data and what data we have available. The link is on the Washtenaw Health for All website. And on that website, you'll see there are many different data points that show some data trends over what we've been seeing, as well as that secondary data, the community input data that we talked about earlier, can all be accessed on that web link as well. And if you have any questions or concerns, I believe there's a function that you can ask those as well. And one thing I forgot to say is, happy National Public Health Week. So National Public Health Week is that saying we are all public health, which we are, and we're doing various different functions of that. So definitely want to spread that love and thank you to all of you who are committed to the work that we're doing to improve our communities. And if there's not anything else, Dana, I don't know if you have anything else I'd like to end with us, or we can go ahead and end our meeting today.
Thank you so much, Corinna, and thank you to everyone for all of the wonderful responses that you've shared in the chat, and for the great questions and comments that you brought up. As Corinna kind of shared throughout this process really isn't something that the health department can do on its own, where we have to do this work together with you. And so we're so encouraged and thrilled that there are so many people in our community that are excited to come together on this and to stay connected to this work and be excited about learning more. So thank you so much, everyone, for taking the time out of your day to spend a little bit of time learning about where we're going with this process. And then as Corinna shared, we will be sending out a follow-up email in the next couple of days to share a link to the recording of this meeting back out with everyone. And we'll also be sharing a link to a quick questionnaire where you'll have an opportunity to share additional input and feedback around what you want to see come out of this process. And we have a couple other questions in there as well to help guide us as we begin thinking about the goals that we'll be developing around each of these priority areas. Thank you so much, everyone. And I don't think we've had any other questions come in. So with that, I think we can bring our meeting to a close. Thank you, everyone.
And thank you all too.
Thank you. Thank you. We appreciate you all. Thank you.
Thank you.
Thank you.
All right.
Bye, everyone.
Bye.
Bye-bye.
See y'all later. All right.
Thank you.